Welcome to Parnassus Research Laboratories. This is really where it all started, probably 30 years ago when David Bradford came to the department. So welcome. And my name is Jeff Lotz. I'm Vice Chair of Research. I'm a bioengineer by training and have been conducting research in biomechanics of kind of various musculoskeletal tissues with a focus on back pain. You know, we're unique and we're proud of the fact that we have a broad spectrum of things that we do well. There's, you know, from traditional biomechanics where we test the physical properties of things, bones, connective tissue, test implants in cadavers, to cell biology, wet bench research, translational research, looking at new regenerative therapies. And that spans across the different laboratories, both here in the MSB 11 building, IRM building, Kirkham, and 6th floor of HSE.
I'm Jeannie Bailey. I'm an assistant professor in the Department of Orthopedic Surgery, and I want to welcome you to the Metrics Lab at 95 Kirkham. So we just opened a new lab for the Metrics Lab space, and it is where we're going to do a lot of testing for tech development, for mobile applications, sensors, so that we can study how people with musculoskeletal conditions can move, and we can also track movement outside of the clinic. Our lab is located at 95 Kirkham, which is on the Parnassus campus, and it's right at the intersection of 5th and Kirkham. We have a full setup for a motion analysis lab with multiple force plates inlaid into the ground. We have a maker space where we can do sort of electronic work on sensors and configuring them for our motion studies, as well as storing all of our devices. So anyone that's interested in doing something that's related to digital health or motion analysis, or even just thinking about new ways to look at patient outcomes, is welcome to come collaborate with our team.
Hi, my name is Rich Schneider. I'm a basic science researcher and developmental biologist by training in the Department of Orthopaedic Surgery. My lab focuses on the developmental biology of the musculoskeletal system. And so what that means is we're trying to understand how embryos make their skeleton. How do they make bone? How do they make cartilage? How do they make muscle, tendon? And how do all of these tissues come together in embryos so that our skeletons can move and can do all the kinds of things that our skeletons need to do to support our lifestyle, to support our activities. Our intention is to use that information to be able to regenerate tissues in cases of disease or an injury. We use avian embryos because we can access the embryos in the egg during development. So we cut a little window in the eggshell and we can study the embryos, we can inject different kinds of growth factors into the embryos, and then we can see how that changes the course of development. In cases of human disease, as we get older, as we age, we lose bone. We would love to have a molecular biology-based solution where we could reverse that process, or we could stimulate a patient to make bone, have their own cells make bone, rather than transplant bone in from another source, like a cadaver or an animal model. We would love to be able to take a patient's own stem cells and coax those cells into making more bone or more cartilage.
Hi, I'm Aaron Fields. I'm an associate professor of orthopedic surgery at UCSF. I direct the Orthopaedic Biomechanics and Biotransport Lab. I'm also the director for the UCSF Musculoskeletal Training Program. My lab focuses primarily on discovering the mechanisms of nutrient transport in cartilage and in bone, and harnessing that knowledge so that we can develop techniques that leverage nutrient transport for tissue repair. Back pain is the leading cause of disability and healthcare expenditures. And in many patients, back pain is associated with disc degeneration. And so my lab tries to understand how those discs undergo degeneration, why they undergo degeneration, And can we prevent it? And in cases where it's already happened, can we fix it? The paradigm for managing low back pain right now is reactive. What I hope people recognize is that there's a real opportunity to shift that paradigm from reactive to proactive. And I believe in a world where musculoskeletal health will be managed in the same way that diabetes or heart disease are managed, in a proactive way.
Hi, I'm Tamara Elliston, and I'm a professor in the UCSF Department of Orthopaedic Surgery, and I'm the director of the UCSF Musculoskeletal Center. So with age, our musculoskeletal tissues decline, and we don't understand what causes our bones to become weaker with age. We feel that by understanding the cellular mechanisms by which these cells in the structural tissues of our body are taking in information from the physical environment and using that to define the physical features of the bone and the cartilage, then that can help us to understand what are the dials that we can tune to make that bone stronger. How can we intervene and prevent that cartilage from undergoing arthritic changes? The vision for the UCSF Musculoskeletal Center is to be a skeleton to connect research across the entire UCSF campus. And that's musculoskeletal research that's happening in the Department of Radiology or Epidemiology, Physical Therapy, and Orthopedic Surgery and beyond, because we understand that the skeleton has the keys that we need to unlock these other diseases. So we bring something really important to the table as the Department of Orthopedic Surgery to come up with the right solutions that'll benefit patients.
Hi, my name is Kelsey Collins. I'm the principal investigator of the Laboratory for Musculoskeletal Crosstalk, and I'm very excited to launch my lab in the UCSF Department of Orthopedic Surgery. So our goal is to keep people moving and facilitate healthy aging. And so the major disease problem that we work on is called osteoarthritis. Our goal is to be able to come up with not only new targets by developing new ways to understand the disease, but also to communicate with clinicians to make sure that we have the latest knowledge about the disease and the patient population, and then to consider, when we have targets, what are new ways we can deliver these targets. So one way we're working on in the lab is to use a cell-based therapy approach by using genome editing and stem cells to be able to simultaneously develop a new way to deliver drugs while we figure out the best targets to triangulate for people. And so we want to do this as quickly as possible. So working in an orthopedics department facilitates that knowledge exchange and the ability to generate data that are going to ultimately benefit patients' lives and hopefully keep them moving.
Hi, I'm Christopher Hernandez. I'm a scientist and professor in the Department of Orthopedic Surgeries and Director of Health Innovations via Engineering at UCSF. So the gut microbiome consists of the bacteria and other microscopic organisms that live inside your gastrointestinal tract. And my group is pioneering our understanding of the effects of the gut microbiome on osteoporosis and osteoarthritis. This work is surprising us on many levels. I mean, recently we just did a study in mice where we showed that a change in the gut microbiome will change the material properties of the bone itself, so the material that the bone is made of. It suggests it might be possible to make a treatment for a person that would improve the material properties of their bone. And that's much more powerful at making the bone stronger than increasing the density of the bone. So maybe one day you'll take a probiotic type treatment and it will actually make the material that your bones are made of stronger and help prevent an osteoporosis related fracture.